Good afternoon. We'd like to welcome you today to the Healthy Flint Research Coordinating Center, Flint Flint Community Webinar on Coronavirus. We are now in week 26, and we want to appreciate each one of you that join us every week. I'm your host today and moderator, Yvonne Lewis. It has been my pleasure to be able to moderate this session on behalf of the Healthy Flint Research Coordinating Center. And for those of you that may have joined us for the first time, whether you be on the web in the webinar or actually joining us on YouTube, we want you to know that the Healthy Flint Research Coordinating Center is a collaborative partnership coordinated by community partners and academic partners. And we have worked diligently over the last few weeks to ensure that we're bringing information that is relevant to us here in the Flint community, but also we're thankful for those who are participating from us from outside of the Flint community and have found benefit of being with us on today. This is a very, very important day for us to remember. I think many of us can remember perhaps where we even were sitting on September 11, 2001. I can remember it was the day when I looked on the television, early morning news, and saw the trade centers on fire in New York City. It was a day that we shall always remember. And it's really interesting how today is reflected in what we see happening every 3 days. I was reminded that there were little less than 3,000 people that lost their lives on that day, but many, many people were impacted. We also are impacted because now as we travel, when we could travel, our travel was forever changed as a result of this day. So I want us to just pause for a moment to reflect on the loss of lives from that day, the change in our world. And while we're reflecting on that, just to think of all of those who have lost their lives even during this coronavirus pandemic. Thank you. It is really important for us to keep in mind that every day now, as we're looking at this coronavirus pandemic, that as a record is being kept, there are at least 1,000 people that are losing their lives. So we want to encourage you as we're thinking about all day today, thinking about this issue, want to encourage you to remember to do what you can to be safe and to protect others. If you're listening today, we have a very exciting program for you today. And I want to again thank all of our partners for these 26 weeks who have been with us. And our banner will show you who the partners are. And I am mindful that some maybe have joined us by phone and you can't see the banners as you're joining us by phone, but I do want to encourage you to go to the YouTube site so that you can see. But just as a point of emphasis, we have had representation from over 26 different organizations over these last 26 weeks, from the Genesee County Health Department to our state health department, our city, our community Foundation of Greater Flint, Genesee Health System, Genesee Health Plan, MTA, Greater Flint Health Coalition, and that list goes on. And they are continuing to be here today, many of them, to answer questions that you might pose as we're in this conversation today. We have a special guest with us today, Dr. Gwendolyn Reyes, who we will introduce more formally later, because there have been many questions about the community schools, and she is going to prepare and provide for us key information about the health and safety guidelines that have been put in place to protect our children. And so for those of you that are listening, please feel free to let someone else know about the webinar that's going on today, because I think families would be very interested in the information that we'll share today. We want you to keep in mind that our goal with this webinar is to provide information to you to help you make informed decisions and to understand what resources are available to you in the community. And so we want to begin today, as we have the last few weeks. We began our conversation talking with Dr. Lawrence Reynolds, who is the Chief Health Advisor, and I want to say Chief Health Advocate as well, for the residents of the city of Flint. He is diligent across the community in conversations to raise issues that many of us, if we're not at the table, are not able to raise. So Dr. Reynolds, we appreciate the service that you're providing for the community, and open up the opportunity at this time for you to share key information for us.
Well, good afternoon, everybody. We are now in year 6 of the Flint water crisis. That is not over, but we can make a tremendous step if we can get our lead service lines out of the city, out of our homes. The deadline to do this is September 18th. You must call. If you think you called in the past and you've had no response and you've not been scheduled, please call again at the numbers that you see on your screen, or 810-232-2558 or 810-410-1133. Please call in. And if you're having a problem connecting with any of those numbers, please call the public health manager for the city of Flint, Billy Mitchell, at 237-2044. We have public health navigators who can help you with water, with filters, but you must call the first two numbers, 232-2558, 410-1133, in order to get your lead service line replaced. If you don't know the status of your service line, call. If you thought you were scheduled and no one showed up, please call. We are managing many crises on a nationwide level, but we have our issues that we must resolve here. So please get your lead service line replaced. The deadline is September 18th, and we need your help. Thank you.
I want to engage you a little bit further just for a moment, Dr. Reynolds, because I think it's really important that we only have 10 days left as of today. So one of the things that you mentioned before is that once they make this call and they make that appointment, it's important that someone is in the home to ensure that once the appointment is made, that they actually get the work done.
And that someone must be 18 years of age. And they'll ask you, are you 18? And if you say yes and you sign, the work proceeds. If you're 13 and you answer the door, that's going to be a problem. Find someone who's 18 and over.
Thank you, Dr. Reynolds. And I'm sure we're going to come back to this conversation next week. That'll be the last day. So we'll emphasize this one more time next week. And I know people are, why do we continue to talk about this? It's very important. One last thing, Dr. Reynolds, if they have some concerns, we talked about the pipe replacement map. And just as a point of emphasis, could you just talk a little bit about the value of people going to that map in the event that they have some questions?
Well, I'm thankful that as a result of the court settlement of previous years, we have a partner, Blue Conduit, who with the University of Michigan designs and updated a map that you can access easily, flintwaterpipe.org. And it is the most accurate record we have of who has a lead service line, who doesn't, but it's not perfect because they have had to rebuild almost non-existent records from over the past 20 years. But it is a resource that you should check. However, if you have any question, please call those numbers, 232-2558, 410-1133, or Billy Mitchell, our public health manager, at 237-2044. And I'm not minimizing the value of the work they have done. What I'm telling you is how bad the record keeping has been in the previous 2 decades or more.
Thank you, Dr. Reynolds. And I want to remind our listeners, Ian Robinson, who has helped to put that map together, is here today, ready to answer questions. So all of our listeners, if you put questions in the queue, their panelists will be there. They'll answer the questions for you. And of course, if there's some that we want to share with everyone, we will make sure that that information gets to the entire group. So thank you, Dr. Reynolds. We appreciate your comments today. As I mentioned to you, Dr. Gwen Reyes, who is with the City of Flint Schools. She is a pediatrician at Hurley Medical Center Children's Clinic. She is the medical director for Flint Community School Wellness Program. She's here to talk to us today about returning to school. Many parents are interested in this topic, Dr. Reyes. I know we're doing virtual school right now, but this is an important topic. Would you please open this topic and help us have a better understanding of what's happening with, particularly as it relates to the school wellness program?
Absolutely. So thank you for having me today. I think this is such an important topic for me, myself as a pediatrician, of course, and even as a parent as well. I have 2 children that are school aged. So this is a topic that's very important, very complicated, but something I'm very passionate about because of the impact it has on our children. So as you mentioned, I am a pediatrician at Hurley, as well as work with the Flint Community Schools, but I do want to share the disclaimer that these are my personal viewpoints and don't necessarily represent the viewpoints of Hurley or Flint Community Schools. But I'm thrilled to share to really open the conversation, because this is a large topic. So I definitely cannot cover things in detail, but really to just take a step back and think about the benefits that we have from in-person education, what some of the challenges we have with virtual education, and those are things that many of us may be feeling already. And then just think about what are the things that our school systems need to think about, and the complications and the challenges with preparing a school environment. And then really to sum up what families need to be taking into consideration to make an informed decision about going back to school in person, if that's an option. So as I mentioned, this is a very, I would say, a complex topic. And so I'm happy to discuss things in further detail as I go through them at the end. But when we think about schools, of course, academics is what we think of first, and that's essential and important. And I would argue the interaction between a teacher and a child, in a virtual environment is great, but different than in person. So that's first and foremost. And then when we think about other services, other supports, other things that schools offer outside of education, those are some of the really important things to consider when we're thinking of virtual education versus in-person education. So some of those academic support plans. So some of our kiddos have, extra reading groups or extra math groups, 504 plans, IEPs. They have these things that are in place that become more challenging to provide the needed support if those things are virtual. We think about the social and emotional skill development that children have when they're in classrooms, when they're interacting with their peers, interacting with their teachers, getting that feedback, learning to read, those nonverbals, learning to play with each other, learning to share, take turns, and having, those social and emotional learning opportunities that they have when they're in person that are very much diminished when they're in a virtual environment. When we think about physical activity, school may be one of the only safe locations that they have to get active, to get out. It may not be safe in some of our neighborhoods, unfortunately, for kids to get out and ride their bike. They may not have access to a bike. They may not have access to helmets to be riding a bike in a safe way. So school may be the only opportunity that they have to actually get active. And we know physical activity is of course helpful for our physical health, but our emotional and mental health as well. So that opportunity is essential in schools as well. When we think about mental health support, many of our schools offer our children, a counselor, a behavioral therapist. They may get their therapist may be through schools. For example, in our school wellness program, we have therapists on site in school that work with our children, and that is helpful. Parents may not be able to get them to appointments. Appointments may, be limited at this time due to impacts of COVID when you're outside the school environment. Other supportive services that our children school age, get through the schools, like our physical therapy, occupational therapy, speech therapy, especially for some of our more vulnerable populations. Those things are done through the school system. When we think about safety, school may be the safest environment for many of our kids. Unfortunately, we know that their child abuse happens in our community, and unfortunately, over the past 5 years, according to the 2019 Safe Kids data, child abuse has been increasing by 30% over the past 3 years, including in Genesee County, one of the counties that contributed to that data. So it was already a concern when we think of pre-COVID. And so that if you think about all the extra stressors that have occurred because of this pandemic, rates of child abuse have continued to increase. And our teachers are there, mandated reporters, and are essential individuals that help report some of those concerns. So we think about safety with our kids being in school. Nutrition, it might be the only safe or only consistent and reliable source of nutrition some of our kids may have. So yes, schools are offering school meals outside of the schools, but there still may be transportation difficulties to get to that location where they're actually giving out the food. And then if our kids are in school, it allows our caregivers, our parents, to actually go back to work. If you have a child that's at home, they may not actually be able to work, or they're trying to work at home and care for their child and support them in school, and it becomes very stressful and challenging, and can then impact their ability to be successful in their jobs or even have a job. And then when we think about the role schools have in addressing racial and social inequities, we know there are inequities, whether it be by race or our Black, African American and Black population, our Latinx, Hispanic population, our Native American population. We already know that there's disparities in school, and so we think about our English learning language students, our children with special needs. There already are some disparities, and when you think about in a virtual environment, those disparities may widen. So there are tons of benefits for being in school outside of just academics. And when we think about being in a virtual environment, there of course are some challenges, and some kids may thrive, and a virtual environment may fit their needs, but there's definitely concerns about these widening educational disparities when we're talking about a virtual environment versus an in-person environment, especially when we think about technology. So does a child even have access to a Chromebook or a computer? Once they have a computer, do they actually have access to internet to use that computer? Do they have someone actually at home to actually support them, to get them logged on to that hotspot, to get them logged on to their classes, to understand the different apps that they're using, to understand their schedule, where they're supposed to be? So that takes a lot of support at home. And if you have a caregiver trying to work and support them, that's a significant challenge. Or the caregiver may not have the skills to be able to support that child. We know we have parents in the community that are not able to read, and so how are parents in that situation supposed to help a child be successful in a virtual environment? Again, our students with special needs, they have additional needs that may be more challenging to meet in a virtual environment. As I mentioned, our English language learners, it's easier for them to fall behind if in a virtual environment. And then again, safety, nutrition, access to those extra supportive services. Many sites have, or some sites have school-based health centers and services that they get. So they may get some of their primary care, some of their vaccines, and access to acute care through the schools. And if they're not in the schools, that's an opportunity that they're missing to focus on their own health care. And then again, just the financial and psychological stress of having to have this additional support to provide to their children, maybe impacting their ability to work and really support their family. So lots of challenges with the virtual mode. And we know in-person education is optimal for our kids. So if we know, in-person education is better, so why aren't our kids in school? For example, our kids in the Flint community schools are all virtual, and many of the schools in Genesee County are similar. So we have to think about how do we create that safest environment for our children and in our schools. And I say safest because a school environment is never going to be risk-free. There will always be challenges with, infectious diseases in schools, and that was pre-pandemic, but of course, even now, more concerning, and we want to make sure that we are thinking about the things that are going to impact that ability to create the safest environment possible. So one of the most important things that we have to consider is really community transmission. So we know the lower the community transmission rate, the lower the risk of schools, because the virus is not being transmitted as much. But what is that low definition that makes it safe? And that's something that we don't know for certain. So different resources provide different levels, different cutoffs for what is considered, low transmission, but to say this certain level is low enough in the community that makes it safe is not well defined. There are many sources that have shared their recommendations. So for example, some resources will recommend just having a sustained decline in positive cases over the past 2 weeks. But again, what does that mean? What percentage of cases are we decreasing? So at one point, CDC recommended a low incidence being less than 10 or fewer new cases per 100,000 people over 2 weeks. And then CDC and WHO also had referenced less than a 5% positivity rate as a threshold for considering it to be low transmission. A resource that I find very valuable, their return to school kind of guidance was created by the Children's Hospital of Philadelphia called Policy Lab, and they do recommend a stable or declining weekly case incidence approaching 10 per 100,000 people and less than a 5% positivity rate. And when we look at the evidence behind schools that have opened in other countries that have done it successfully, some of those community transmission rates were actually less than 1 new case per 100,000 people. So where is that safe level? To say with certainty, we don't know, but majority of the most consistent data would say at least a less than 5% positivity rate in the community. Can you go back one slide? So when we think about Genesee County, where are we? So every week, Genesee County does update their COVID-19 testing results, which this is updated per Wednesday, but it didn't change much this week on Thursday. So the positivity rate in Genesee County is 2.3%, and as of yesterday was 2.4%. So you think, great, we're under that 5%. It's looking good. Maybe our kids should be back in school. But we have to really think about, one, who's being tested, how many people are being tested, or all people that are symptomatic even being tested. And I would say from my own clinical experience, and even in our clinic, not all families want to be tested. And so there's a potential that you're missing some cases there. And there just may not be access to testing for everyone in Genesee County. So, we have to keep that in mind when we're thinking about how safe the school environment is. But even more importantly, we have to think about what role children play in virus transmission. And I think this is an area that's been more concerning the last couple of months as we're seeing more and more cases being reported in kids. The American Academy of Pediatrics has been monitoring the number of cases throughout the country from majority of the states, and they have reported over 500,000 cases in the country in the pediatric population, which is almost about 10% of all of our cases. And what's more concerning is when they looked at the number of cases from July to August, there was actually a 90% increase in cases in children compared to previous times. Fortunately, that those numbers are decreasing in the sense it's not increasing as rapidly. Cases are still increasing in children, but the numbers are decreasing in the sense that now the last 2 weeks, there's only been about a 16% increase in the number of cases. But that being said, cases are still increasing in our kiddos. Fortunately for our kiddos, cases are generally mild or even can be asymptomatic. We know that there are much lower hospitalization rates for our kiddos, meaning a lower rate of significant severe complications. Only about 1.9% of the kids that have had cases in the country have been hospitalized, and even lower, 0.02% of our kids have actually died from COVID. So those are positive things, but that doesn't mean there's not risk. So some of our kids will get severe illnesses, some of our kids will be hospitalized, and some will even pass away from this virus. So it's not a no risk environment. So then when we think about what does it mean for those kids being in a school environment, which is really the big question. Are kids going to pass this virus to our adults? Are kids going to get our adults sick, who then may have more complications than our kiddos may have? And that's where the data is a little bit more, we need more data in that area. So we do know that our kids that are adolescent ages transmit the virus similarly to adults. But there is a hope that the kids can, they can follow some of these mitigation measures, which we'll talk about shortly, a little bit better than our younger kiddos. more recently data, so initially we were thinking our adolescent kids were the highest risk to transmit the virus, and the younger kids likely are not as likely to transmit the virus. But our data is shifting to show younger and younger kids probably have more of a role in transmitting our virus. So we know kids 10 and older, not just our adolescents, can transmit the virus very similar to adults. Even more recently, our younger children, those that were symptomatic, studies are showing that those kids have virus similar in their noses as adults do. But the question is, are those kids going to transmit the virus similar to adults? And that's what we don't really know. And that's one of the key questions in terms of keeping school environments safe. And then even less is known about our asymptomatic kiddos. So our kids that don't actually have symptoms that may have the virus, are they able to transmit that virus? And that's what we don't really know. And that's what is key to take into consideration when we're thinking about a school environment. So of course, when we're talking about mitigation measures, that's really the key to setting up that safe environment. What can we do to create an environment that's safest for our children? So of course, having a low community transmission rate is most important before you even consider opening up your schools. But then there are a whole number, and this is not an exhaustive list, but some of the ones I wanted to highlight of things, protocols, policies, resources that need to be set up before we can consider opening up our schools. And as hopefully everyone's aware, June 30th, the state did release the return to school roadmap, which I was part of the council that worked on that roadmap, that had some minimum requirements, mandates that schools had to put into place, and some other very strongly recommended and recommended mitigation measures to try to create an environment that was safest for schools. But the challenge is, we know one school is not going to be identical to another school, depending on maybe one's inner city versus a rural school. The resources are different, the environment looks different. So we had to create a plan that would provide some guidance, but also allowed for some flexibility for different school districts to set up a plan that worked for them. So some of the really important things to consider. So even before students enter the school, enter the doors of a school, really thinking about, do they have symptoms? So parents need to be educated to know what signs and symptoms of COVID are, and making sure that they are keeping their kids home if they're sick. And the same for them. If they are sick, they're not going to work. And when we think about our school staff, because these are measures we want to consider, of course, our student safety, but our teachers, our staff, anyone that's in that school, we need to think about their safety, not just our students. So school staff should be comfortable staying home if they have symptoms, reaching out to their physicians to figure out what the best next step is. But that can be challenging. So if you don't go to work, if you're not getting paid, how are you going to then sustain your family? And so we have to really think about policies and protocols to support our staff and students from staying home without repercussions. And that for students would include having a virtual option if they're going to be out of school, whether ill but not so ill they can't participate. So that is a huge piece before kids even enter the door. When we talk about face covering, so we do recommend any child 2 and older, anyone 2 and older, should be wearing a facial covering, and that will really help with the spreading the virus. And we know there are going to be certain situations, especially our younger children, kindergartners, to keep a mask on their face, over their nose, without touching it, without chewing on it. Those are challenges. So those are things we have to take into consideration when we create a school environment, knowing that not all those children will be able to correctly use a facial covering. Do we have resources for our teachers or those staff that are taking care of our sick kids? Because we know kids are going to get sick every school year. Kids get sick. Does it necessarily mean it's COVID? No, but can we tell that without actually testing a child? No, because it's very similar to other viral symptoms. So we have to have adequate PPE for our staff or our school nurses, if they have them, to be able to protect themselves when they're caring for these children. And again, before they even get in the door, transportation. So if you think about potentially in a classroom, you could space out your children, but on a school bus, that's more limited. You can't just go buy new school buses. You need the buses and the drivers and such. So it's much more challenging to physically distance your kids on a school bus. So the more tracking of students that are riding on a bus, you're sitting by the same child every single day, you're minimizing the exposure to different children can help, but there's always going to be risk just thinking about transportation before you even get the kids in the door. And then thinking about schedules, should all students be there at the same time? Should schedules be staggered so you can have potentially your younger children there at one time and your older children, there at a different time? Same thing with like walking in the hallways. You want to make sure that there's not every student in the school walking in the hallway at the same time, which may mean changing, class schedules to get out at different times. So you have, these smaller groups of kids that are around each other without kind of hanging out in their hallways and talking to each other like they may want to. But again, all of these things to decrease their potential exposures. Physical distancing measures, everyone has heard, I'm sure, stay 6 feet away, have your mask on, stay 6 feet away, good hand hygiene. But when you think about that in a school environment, it may not physically be possible to have an entire classroom 6 feet away from each other. It's just not possible in many environments. Of course, hand hygiene, having the resources, having breaks in the day to make sure everyone can wash their hands, especially when classes are changing, etc. Cohorting our students can be very helpful to keep kids in a smaller group to be able to minimize the exposure. So if you have your class is a core group of 10 children and you kind of do everything with those 10 kids, you have less exposure to others and less risk in terms of contracting the virus. And then it's helpful too when you think about if a kid does get sick, you only have these maybe potential 10 or 11 people that would potentially get exposed versus an entire classroom of 20-some children. But again, from a school perspective, how many teachers do you need if you only have 10 students in a classroom? Do you have enough buildings for that? Do you have enough support staff? So it's easier said than actually done to create that environment. When we think about actually being in the classroom, are kids going to change classrooms and go to different, their different special classes they have? Are they going to be in different areas with different kids? The more exposure, of course, the higher the risk. So really minimizing those changes and having teachers change rather than students change can be helpful. When we think about ventilation, making sure there's good ventilation in rooms and on buses, keeping windows down, windows open is important to keep any of those aerosols that are in the room from kids talking or laughing or crying, anything. But many of our schools are old and they don't have adequate ventilation. So having the resources to make improvements in that is difficult and challenging. So then when you think, we know a kid's going to get sick, whether it be COVID or not, having protocols in place for what do you do when that kid comes down, who gets isolated or quarantined, who should be tested. These are all policies and protocols that need to be in place and well understood by your school staff before you can actually open a school. And that takes collaboration with your local health department because a lot of the guidance will be collaborative with your health department. So those are things that need to be in place. So you have a safe place for a child to go if they're ill, have someone that's evaluating them away from other children in case they potentially have COVID so that you're not exposing other people. And again, that takes space and personnel and PPE to do that safely. So do you have those things to be able to provide that safe environment? And of course, all of this is stressful and scary, especially for our kiddos, for our staff. We recognize that. So having those behavioral health, emotional health, and mental health supports in place to be able to provide the support that your staff and your students need. And again, easier said than done. And this is not an exhaustive list, but some of the things that we really have to think about and recognize there are challenges with those. And these are things that need resources and money to be able to put in place. And that is something that is a barrier for creating kind of the safest environment possible. You can go to the next slide. So how do we kind of prepare our kiddos? So I just want to remind everyone, if there is an option in terms of returning to in school, what are some of the things we can do to prepare? So for one, following up with your doctor. So see your PCP, your primary care doctor, get your well child visits. Doctor's offices are open, so please, follow up with them. Shots should be up to date, including that flu shot, which I know we're going to talk about more later, but so important, especially in a pandemic where we likely will have flu and COVID at the same time. Preparing your own health as much as you can is the most important thing. Parents can be role models for using masks at home, for facial coverings, making sure that their children know they're important because they see you wear them and they see you value wearing them. Making sure if you're going out to the store or such, wearing them, and practicing at home. So have your kiddo wear it at home, practice, reminding them not to touch it and kind of distracting them if they are, so that they get used to wearing it and it's not a surprise when they're at school. And it's something that they do at school and at home. It becomes kind of our new normal. And then thinking about being at home now, thinking about that your kiddos are doing virtual education at this point, you want to set up an optimal kind of environment for them to learn, so that we can make sure you're getting everything you can out of that virtual environment. So having a child space where they can be free of distraction as much as possible, and sometimes even just putting like a cardboard poster up so they have their own space, they can decorate it, make it their own place. Trying to keeping them in an environment where the TV's not on, other people aren't cooking in the kitchen, things like that. So making sure they have a space that they can concentrate and focus, so that they can maximize everything that they're getting out of their virtual education at this point. So we want to make sure that our kiddos are prepared and well rested for school. So I think that's just one reminder. I see lots of our kiddos that are still going to bed really late. So, kids should be sleeping 10 or 12 hours at nighttime. So please, set them up to be as successful as possible, because being on a computer for 3 or 4 hours a day is challenging for anybody. And a tired child it's going to be even more challenging. So in summary, I just wanted to highlight a few of the considerations for families to take into consideration. So we know there's lots of benefits to being in person. We know some challenges with virtual, and if the environment can be the safest possible, I do highly advocate for our kiddos to be back in school. But it really has to be a family consideration and a family decision, because there may be other risk factors that you have in your family or that student that you need to take into consideration to make sure it's a safe environment for your student. So in terms of adults, we have a lot more data on what puts adults at increased risk, as you can see on the screen. Kids, there are some conditions that that they might be at higher risk, but we don't have as much data to support that our kids are being disproportionately impacted with some of these other conditions. So it's really a family decision. Do you have a grandma at home, or elderly parents at home that you're caring for, and that may have a poor outcome if they get exposed? That might not be the best choice to have your child in school when we're still seeing the cases in children rising, versus a family that feels there's no health risk and they really benefit from being in school. That might be more appropriate for others. So it's really a family decision if there's that option through the school district. So in summary, in-person education has lots of benefits, as I've talked about. There's some challenges with virtual education. Kids should go back to school in person when we can create that safest environment possible. But this takes time, it takes planning, it takes funding to be able to do this. And it's really that family decision. So I'm happy to answer any questions now or later, whatever works best for everyone. But thank you.
So yes, Dr. Reyes, thank you so much. And we do have a question in the queue. I want to just say thank you for giving us all of those things to consider. And appreciate you saying until many of these things are considered, we will be in virtual school settings, even though you're advocating for that in person. This is really important for families to have so they can make that informed decision. One of the questions in the queue says, do you think that the face shields will work better for kids than wearing masks all day?
So if you had an option of no protection versus a face shield will provide some protection, but a face shield is not equivalent to a facial covering. So a face shield, generally you're gonna have a plastic covering in front of you, so it may protect you some, but there's a lot of room on the side. So the safety in terms of a face shield versus a facial covering is not the same. So I would highly advocate for facial coverings. There may be situations that it may be more appropriate, though, if you have a child with special needs and they really cannot wear a mask, because there are some exceptions to wearing a mask. So, of course, if a child is sleeping or unconscious or in those things, a mask should not be on their face. But outside of the inability to actually remove that mask or other conditions that put them at risk, like being unconscious, then really most kids can wear a mask. And there are very few exceptions, medical exceptions to wearing a mask in kids. So for example, asthma comes up a lot. A child with asthma, unless it's very poorly controlled, kids with asthma can wear masks and they will be fine. And it's probably more of a benefit for a child with asthma because it potentially could be at higher risk from complications. So there's very few exceptions. Some children with kind of behavioral challenges may take some time to get used to wearing a facial covering. So those may be situations that wearing a face shield is better than nothing, but we're also at the same time working on getting them used to having that facial covering. Maybe you wear it for 5 minutes under your shield, and then you build up that time, over the time they're in school, so that they feel comfortable wearing that facial mask. And parents can practice and do that at home as well, so that you're building up that tolerance. So if you had the choice of nothing versus shield, I would shield absolutely is going to be more protective than nothing, but it doesn't compare to wearing a facial covering.
Thank you, Dr. Reyes, because I know that some people have thought they could do either or, but as I looked at Dr. Tupper when he came on, I caught it in his hazmat gear, he had both the shield and the mask.
Mm-hmm.
So thank you for giving us that info. So we want to ask you to stay with us, because we're going to have this additional conversation, and you may want to weigh in on this. You brought about something really critical, and with our children going back to school, there are two important things, and that is, number one, that there are testing sites available to have the children tested, but also the flu vaccination. Susan Kupel from the Health Department is here with us, been with us every week. She's going to give us an update from the Health Department, and then we'll move into our discussion about the influenza vaccination and other vaccinations. Suzanne.
So, hello everyone. I wanted to follow up and just remind everyone that the Genesee County Health Department posts COVID-19 data every day by 2 p.m. at www.gchg.us. And we do this every day of the week. That includes the weekends, so everyone can be up to date on the latest information regarding COVID-19. So as of yesterday, we posted 3,321 positive COVID-19 test results with 279 deaths, with a 2.4 positivity rate. And you heard Dr. Reyes mention that last week it was 2.3, so it's up a little bit. We want to remind everybody that it is important to have access to testing in our community. And last week we were able to bring up 3 new community testing locations. So Word of Life is testing Tuesdays through Thursdays from 12 p.m. to 6 p.m. Bethel Unitas Methodist Church is doing Tuesdays, Wednesdays, 10 a.m. to 4 p.m. and Thursdays from 1 to 7. And Macedonia Baptist Church is providing testing Monday, Friday, and Saturday from 10 a.m. to 3 p.m. All of these locations have had site visits. We've made sure that they're ADA accessible. All of these locations can accommodate both adults and children being tested. There's translation services for those who have English as their second language, anyone who's using sign language. All of those accommodations will be made. Appointments are strongly encouraged, but people can come. We fully recognize that not everyone in our community has access to a computer or the internet. So someone who needs to get tested can show up and they will be accommodated. We still have other locations in our community where we can get tested. The Rite Aid in Swartz Creek and the Rite Aid on Clio Road in Flint, the Hamilton Community Health Network Clinic at the North Point Clinic, and at the Burton Fire Station at the corner of Bristol and South Saginaw. I've had a great conversation with Claire and Spears. They're going to continue to operate these testing locations for as long as they're needed in the community. So they will be there into the fall. And the Walmart Super Center, which is on Corona Road in Flint, is still testing as well. All of those testing sites do require that you make an appointment, and there's online or telephone options for making those appointments. So we've talked a little bit about immunizations, and I think it's important to remind everybody that the health department strongly encourages everyone to have a medical home, a regular source of trusted healthcare information, someone that you can go to who knows about your health, who knows about you, who can provide you appropriate guidance about how to proceed with your health. We've talked in the past about the importance of everyone that has any kind of emergent condition, if they are having a stroke or heart attack, to please go to the emergency room. That is the safest and best place for you to get care, and our hospitals are prepared to receive you. But having that regular trusted source of care also helps you make sure that you are doing your very best to take care of your physical and your mental health as we're dealing with COVID-19. So that means getting all your preventive screenings, mammograms, pap smears, prostate tests, anything like that, making sure that you're also up to date on your immunizations. And so we have been promoting for months now getting the flu immunization, because we know we're going to have 2 respiratory illnesses in this fall, COVID-19, and we also will have the flu. We still are dealing with Legionella, and we've had over 20 cases of Legionella this season. That season tends to go into October. So as Dr. Reyes mentioned, many of these have the same signs and symptoms. So it's critically important you have that trusted source of medical care, but also that you're monitoring your health and you seek care when it's needed. So I will also let you know that the health department has not received all of its vaccine as of yet, and we've been told there are delays in shipments because of some of the severe fires that are happening right now in California. So some entities like your local doctor's office, the health department, or federally qualified health centers don't necessarily have vaccine right now, but they will have vaccine. So I encourage you to keep in touch with them and ask about the vaccine availability. Many of our pharmacies have the vaccine available, so it's another great resource in our community to go and to get your immunization. And as we'll talk a little bit more, there are going to be many immunization clinics in our community, and it's important to take advantage of them. I'll also say that we're working very hard right now, making sure that anyone in our community who wants the flu vaccine can get it, regardless of whether or not they have insurance. So we'll have more to say about that as we move forward. But I want to pass the baton back to Yvonne to talk a little bit about the September 18th drive-through vaccine event.
Thank you, Suzanne. I'm going to ask Dr. Wolford, who is on the line. We're going to talk about this immunization event that's coming, but I also want Dr. Wolford to talk a little bit about why immunizations are important, both the flu vac and other immunizations, before we get into this discussion. Dr. Wolford.
Hi, Yvonne. Thank you so much for this opportunity to emphasize again the importance of all immunizations. And so I'd like to mention, particularly for our younger ones, that over the course of this pandemic, we have some people have missed visits, and so children have fallen behind on their vaccines. But it's important to protect them against illnesses that we know we can protect them from, so that this fall we're not overwhelmed with COVID and then influenza and then all of the other things, the 14 different things that we can protect kids against if we get them vaccinated. And hopefully you can see behind me these images. This is the image of a brain, a healthy brain. And this is the image of a brain where the child has been infected with meningitis. We have a number of vaccines that can prevent meningitis in children, because if they should have this kind of infection, it can lead to very bad outcomes, long-term disability, and of course, death. And so we want to avoid it. And we know we can, because if I lean this way, I can show you a graph of cases of meningitis caused by something called Haemophilus influenza B, we call it HIB. And we see there at that point when the vaccine became available, the number of cases went right down to the point where we barely see it these days. And we barely see it because kids are vaccinated against it. So just want to emphasize that while we're waiting for a vaccine to come out for COVID-19, we already have vaccines that are preventing our kids from getting very severe illnesses. And so we don't want to let those vaccination rates decrease. We want to keep that up. So as has been said by many others on this line, doctors' offices are open and ready and waiting to give those vaccines?
Thank you, Dr. Wolford, and appreciate you bringing that point about other vaccines that are available, because we have been working on, particularly, we have a partnership, we call it the Genesee County Influenza Immunization Education Partnership, and some of the partners are at the bottom of this slide. And we've been promoting influenza vaccinations since 2011. Because there was a great disparity in the number of African Americans and people of color who were getting their vaccinations. Now, Jim Melanowski, he's on the line as well. He's the CEO of the Genesee Health Plan and has supported this event for the last 7 years. So I want to give Jim a moment to talk about this activity, and then I can chime in a little bit more as well, Jim.
Thank you, Yvonne. Yes, just to reiterate what's already been said, it's just so important to get the flu shot and other vaccinations, and we're so happy about this partnership that there is in our community, trying to reduce those disparities and making it kind of easy for people to get these. They can go to their doctor, they can go to a pharmacy, and there's going to be clinics throughout the county that will help get these. And so the health plan, Genesee Health Plan, is hosting one at our location. We've done this 7 years now, where we simply have a drive-through clinic. It's rolling down driving up, rolling down your window, rolling up your sleeve, and someone will administer a flu shot. And what's really cool this year is that we have flu vaccines for children ages 4 and older. So we heard Dr. Reyes talk about flu shots for children. And so there really is an opportunity here to get those at this drive-through vaccine event. We're also going to have health screenings for women 40 to 64 there, and also census. You haven't talked about it yet today, but how important the census is going to be. And so while people are waiting in line with their cars, there's going to be enumerators available and going and getting census done while people are waiting. So, and I also see free ice cream. So you can't beat this event coming up next Friday, 3 to 6 p.m. at Genesee Health Plan. You don't need an appointment. You just come. And there's also no out-of-pocket costs, because Walgreens is administering the flu shot. They're going to collect health insurance information because they have to, but there's not going to be any out-of-pocket costs. I don't know of any insurance that's not going to cover a flu shot as a preventive services, but there is not going to be any cost to somebody, especially those who have no insurance or don't have an ability to pay. So we got all that covered as well, Yvonne.
Thank you, Jim. And I want to just appreciate the partnerships. As you can see, even from the webinar today, we have a number of community partners that are working to ensure that there are no barriers to these services. So here's another opportunity for us in the community. We want to remind you, and Jim mentioned the census, and we'll talk about that in a moment, but there is no need for registration for this event. Just come between 3 and 6 on next Friday and get your flu vaccination. And we'll also have a bilingual health navigator there for those who have English as a second language. So thank you, Jim. Thank you, Dr. Wolford and Suzanne. Just want to say, any of our professionals, I just want to offer another opportunity for any critical information around the influenza, and even in this case, to re-emphasize for our children that we also want to make sure that they recognize these testing sites are available for children to get that coronavirus test as well. It is the house swab. And Suzanne, you can talk a little bit more about that, just as one more opportunity to emphasize that.
Yes, I think it's truly important to recognize that we are not doing the nasal pharyngeal swabs at these 3 new community sites. And that's a bit intimidating, those nasal pharyngeal swabs for many folks. So they are doing that saliva test. And again, it's a little less invasive, and we are making sure that we're addressing both adults and children. I do want to take a moment too to remind everyone that last year we had an outbreak of Eastern equine encephalitis in the state of Michigan. And we are monitoring very carefully because there have been cases in animals. But it's also important to remind everyone to get your pets immunized. And particularly in this case with Eastern equine encephalitis, for those who have horses, they should be immunized against this disease. So not only talking about the immunizations for our human family members, don't forget about our pet family members and making sure that they're cared for as well.
Thank you, Suzanne. And there was a question in the queue. Yes, this event, Be Wise, Immunize, Dry Flu event is going to be publicized on social media. And we encourage all of you, if you want to get more information, to send an email or call a health plan, and we'll be sure to get you a copy of this so that you can help us share it as well. Gary Jones, thank you all of you. Gary Jones is on the line with us today, and he always has tremendous updates from our governor's office. Gary.
Good morning, everyone. So a couple of updates. Statewide total confirmed cases for COVID-19 have surpassed 100,000. We are now at exactly 109,519. The total COVID-19 related deaths are 6,569. And total recovered COVID-19 cases as of September 4th are 80,678. And as a reminder to everyone, recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. So recently, the governor launched a new First in the Nation Futures for Frontliners program to offer essential frontline workers a tuition-free pathway to college. So this announcement was made with leaders in education, business, labor, and workforce development that launched, again, the nation's first program offering tuition-free college to an estimated 625,000 Michiganders who provided essential frontline services during COVID-19 stay home, stay safe orders between April and June of this year. The governor also recently signed an executive order clarifying the face covering requirements for organized sports. So through this executive order, it clarified the rules on face coverings for organized sports during training, practice, and competition. The order specifies that a face covering must be worn at all times by athletes training for, practicing for, or competing in an organized sport when the athlete cannot maintain 6 feet of social distance. The governor also signed a bill to provide funding for enhanced federal unemployment benefits. So this was Senate Bill 745. It appropriated $2.8 billion in something from federal revenue receiving unemployment benefits. At this time, eligible claimants do not have to take any action to receive the additional benefit amount provided by the program. The governor also reiterated a call on President Trump to fully fund the Michigan National Guard. And actually a voicemail was recently left denying his request. This update came either it was this morning or yesterday. Also, the governor extended an executive order protecting grocery store workers, nursing home residents, and staff from COVID-19. So through a couple of executive orders, this will continue to protect frontline workers in grocery stores, pharmacies, and long-term care facilities. The governor's orders continue to require stores by 2 hours a week of reserved shopping time for vulnerable populations to protect consumers and employees at grocery stores and pharmacies. And it will also carry on protections for both staff and residents by requiring strong health and safety precautions such as testing, cleaning, and disinfecting, PPE, and social distancing as well. And just as a reminder to everyone that michigan.gov/, is still the best website to keep up with all updates.
Thank you, Gary. And your information is up on the screen, so all of you know, if you want information about what's coming out of the governor's office, you can connect with Gary Jones. Now, in these last couple of minutes, we are on countdown, the census countdown. We are now at 20 days to go. You have a couple of minutes to put your questions in the queue. I know you're on the line, Tony, but I want you to come back and be with us next week. But we have 20 days to go. There will be enumerators across the city helping out in a number of events that are coming up. So please be on the lookout. If you know someone who has not completed their census, There's a lot of help out there. So we appreciate the city who is supporting and sponsoring a number of events to make sure we get counted. Now, we want to just move the final recommendations we want to offer for you today. You have heard these recommendations before, and I want us just remember, we've been told a number of times, let's follow the universal precautions. Let's make sure that we are washing our hands and staying safe. We want to follow those protocols. We want to remind you that the census, again, 10 minutes for 10 years, that will help us have the funding that we need to take care of the necessary things for our community. And plan your vote and vote your plan. Dr. Deb can sure enough say this really good, but plan. Make sure that if you haven't completed your absentee ballot, that you will do that, complete that absentee ballot, and early voting has started in the state of, will start in the state of Michigan on September 21st. So plan your vote and vote your plan. Go to vote.org and check your status. There's so much that we have offered you today. I hope that this information was valuable to you. And please continue to follow us, join us in this work that we're doing. Like us on Facebook at Healthy Flint Research Coordinating Center. Subscribe to our YouTube channel, Healthy Flint, or you can email us any questions that you might have or the need for information at info@healthyflint.org. We want to invite you again at the end of this webinar, as soon as 1 o'clock hits, or shortly after that, you'll receive a short pop-up survey that we would like you to complete to help feed us information. That these are our attempts to answer the questions that you are interested in. So please provide that information for us. We will be back next Friday, September 18th. And it does say have a good Labor Day, but we hope you had a safe Labor Day. And we look forward to having an opportunity to share with you again next week on the Flint Community Webinar on Coronavirus, sponsored by the Healthy Flint Research Coordinating Center. We appreciate you and look forward to meeting with you again next Friday. Thank you all for joining us today.